excited to hear this topic myself. Just being in this space and being working in child abuse and maltreatment field is very important that we understand this information. These updates are so important. And so I'm excited to be here with you all today, as well as learn with you all today. Alrighty, so on the next slide, we will be handing it over. I'm going to hand it over to Dana, and so that way she can kick it off and we can start talking about this wonderful information and all of the updates that California has.
Afternoon, everybody. It is so great to see so many people here to learn more about mandated reporting to community supporting. We're happy to have you here and engaging you in this really critical work for children and families. My name is Dana Blackwell, and I work for Casey Family Programs, representing the foundation's efforts in California to transform the child protection system, its policies and practices in ways that are supportive of families and ensure child safety. I'm honored to make a few remarks today as the co-chair of the PEI Committee of the California Child Welfare Council, member of the Mandated Reporting Advisory Committee, Steering Committee, and importantly, as the co-chair of the former Mandated Reporting to Community Supporting Task Force. The Prevention and Early Intervention Committee worked closely with the state to leverage the Family First Prevention Services Act in ways that surpassed expectations to help set the course for where we are today. I'm joined by my fellow PEI co-chair, Dr. CalTrin Eisenhower, and the MRAC tri-chairs. I want to first speak to the fact that we would not be where we are without the partnerships that have been strong from the beginning of this work. The California Department of Social Services, the Office of Child Abuse Prevention, the Department of Healthcare Services, and Safe and Sound. Now the partners are growing to include other essential areas across the health and human services continuum, including the Department of Public Health, the Office of Youth and Community Restoration, and the Office of the Surgeon General, just to name a few. It is heartening, and it is one of the main things that is moving the work forward. And talk about work moving forward. This extensive and committed effort has moved at a speed that I don't think any of us thought was possible when we first started. In March 2023, the PEI Committee's Community Pathway recommendations were approved by the California Child Welfare Council. Recommendation number 1 stood up the mandated reporting to community supporting task force. Fast forward to July 2025, just less than 2.5 years later, 3 of the transformative recommendations from the task force are already in law. 2.5 years from a mere concept of how to move from system innovation to community support, and we have built a groundswell of action that is statutorily changing how the state is working to safely keep children and families together. It's really incredible. I have been in the child welfare field, I will say, over 20 years. I've never seen transformation move at this speed. It's really exciting. And as you hear more about the MRCS task force and the recommendations it produced, as well as the mandated reporting advisory committee that is responsible for the implementation strategy, I hope we all fully embrace the momentum that has built to transform mandated reporting in California and the possibility that it provides for children and families. Together at the state level and in every county, all of us have a rare opportunity to move swiftly and strategically toward child, family, and community well-being. Thank you for taking the time to be here and to learn more. I'd like to invite Kathy Eisenhower, the person with whom I've had the pleasure to work alongside for several years, making good trouble on behalf of kids and families in California. She will share how our mandated reporting reform will only be successful in an ecosystem of prevention and community supports and services. Kathy?
Thank you, Dana, and thank you. I'm glad you said a few years, because then we would be really pushing past that 20 that
Yes.
you've been talking about. I want to thank you for your really long-term partnership, and also take this opportunity to to say a special thanks to Casey Family Programs. You did not mention them, Dana, in your long list of partnerships, but really the support that Casey has provided has helped to lay a foundation for all of the incredible work that we are doing right now. So just want to lift that up, their support for us. And so, as Dana is saying, California is really on a path to child, family, and community well-being. And I can beat that 20 years by about another 20. For those of us who have been around a long time, we have been pushing, slowly pushing. And then, like Dana said, all of a sudden, we have got our foot on the gas pedal, so to speak, in order to make this bold vision really move forward. And I have to say that California really took advantage of the Family First Prevention Services Act when it passed in 2018 and did something that I am so incredibly proud of. They put forward a vision for child and family well-being in their plan that would expand the work that we're doing to all families, that all families would have access to a community pathway, that there would be no wrong door to those supports. And they have continued to push that vision as we move forward. If you can go to the next slide, I wanted to kind of let you know the ecosystem. And I know it looks like a whole lot of stuff here, but this represents the prevention ecosystem that we have been building. And I will guarantee you in a year, this is probably going to look different as we continue to build upon the work that we're doing. But this has really like set the stage for the thinking around the larger picture. If you look at the right-hand side, you will see the FFPS work that is going on, and you will see that it is aligned with the work of the Mandated Reporter Advisory Committee. You'll find out more as we move on, but definitely as we move forward, we are aligning this work in order to share our every effort that we are making. And reforming mandated reporting, what you're going to focus on today, is really like a critical key piece of making this ecosystem really be successful and be effective. If we can honestly replace surveillance with support, if we can not only acknowledge but truly address the racially driven disproportionate reporting of Black and Native American families, then we will begin to establish that community trust that is really essential to us moving forward. With this ecosystem in place, I feel like we do have the bodies here, that we do have the efforts in place in order to make this work move forward and to continue to stay on the same fast pace that we have been working on to get to this point in time. My challenge to all of you is that, we are here today telling you what we're doing, but we need all of your support. We need you to jump in. We need you to engage in whatever seat that you are in. If you are a community provider, if you're working at the county or at the state level, it's going to take all of us to really move to that bold vision of a child, family, and community well-being system, a bold vision that I believe we can make a reality. So with that, I'd like to turn it over to two of our tri-chairs for the MRAC. Juan and Alicia are here today, and I want to acknowledge and thank them for their leadership, the efforts that they have been making to move us from planning to action with our recommendations. And with that, Juan, Alicia, handing it over to you.
Good afternoon, everyone. What an honor and privilege to be with you all, and just seeing the different areas of the state that are represented here. And I saw the registration list as well. I want to just say a little bit about myself very quickly. This work is deeply personal for me because I was a children's social worker and a child abuse investigator about 25 years ago now in LA County. I now work in schools, and I've known for a long time that this system has done harm and disproportionately done harm to our historically underserved kids and their families. It feels full circle to be able to contribute to meaningful change. One of my favorite quotes is, "Our systems are perfectly designed to get the results that they do." This is a system that was designed to do disproportionate harm. And it is our privilege, I would say, to remake the system in the ways that Dana and Kathy have lifted up, and that this task force has charged us to do. I'm also from the San Joaquin Valley. Shout out to Fresno. I'm a Bulldog. I went to Fresno State. Really grateful to be part of this conversation and to learn alongside all of you. And excited to have a conversation about how we can all engage in this work, as Kathy said, from whatever spaces we occupy across our beautiful state and country, for that matter. I know we have folks from out of state here as well. There's a lot of good work happening, but there is also a lot to do. So thanks for leaning in with us. Thank you. Go
Thank
ahead.
you, Alicia. Appreciate that. And it's definitely been a privilege so far working alongside with you and Janae, along with the steering committee as well, Dana and Kathy and Beth and all of the leadership going on there and support. So this is exciting work. It's exciting work. And so for me, as a former system involved father, this work is really, really true, close and dear to my heart. When I was presented the opportunity to be a part of this work, there was no way I was going to say, I don't have time, or there's so much I already have. I mean, we all have so much on our plate. This is something that you just cannot ignore. And so I felt, really, it really tugged on my heart to make sure that I made myself available. So this work is just going to be going forward, and to be able to make an impact on generations to come is just truly honoring. So if we move on to the next slide, because my face is like right there, I'm staring at myself. I almost wore that suit today. I'm glad I did. All right, so what kind of some of the things that we're going to be going over, definitely centering the conversation around our lived expertise, something that I definitely am appreciative of the intentional, right? Because this work is intentional, and providing a space for lived experts is intentional, and that's something that I've seen from the beginning, that has definitely been there. So I appreciate that. The why of mandated reporting reform, definitely going over our why, something that keeps us centered and really rooted in understanding. We may get into weeds sometimes, but then if we come back to our why, we get centered right back into what we actually need to focus on. Some historical perspective, standing up the mandated reporting community supporting task force. I know it's a mouthful, but I am the acronym police. You will rarely ever hear me say any acronyms, because I feel like the way we speak is the way we're going to be speaking to families. So recommendations for transformation, implementation of early wins, and creating sustainable change together. Our learning objectives, as you see on the screen, examining the unintended consequences of mandated reporting on California's child and family court system, engage in shifting the statewide narrative, which we feel definitely something that we all are going to be able to have a part in, from reporting to supporting, so families and children can remain safely together. Highlight actionable reforms to realign the mandated reporting system that can align with other vital components of county state work. And last but not least, understanding the need for and impact of engaging multiple diverse stakeholders, with an emphasis of our individuals with lived expertise and experience. We'll move on to the next slide. You cannot have a training, especially with CalTrin, without any poll questions, and we appreciate CalTrin's support on this. We will be coming out with a poll should be popping up. We want to know. We want to hear from you all here in attendance, and I see a big representation from my people here in San Bernardino County. Appreciate that. Neil and Empire, Riverside, Southern Cal. I see you all. I'm a Niner fan, so I'm kind of all over the map anyways. Had to throw that in there. I know Dana's probably shaking her head right now. Which best describes where you and your organization, county agency, is right now in advancing this mandated reporting reform. And I see those numbers quickly going up, so we appreciate all of you all that are attentive to this poll. If you are sharing a room, let us know in the chat. If you're watching with multiple folks in a room, let us know in the chat, so that way we know that we're reaching capacity. If your neighbor in your next cubicle is also attending, make sure you throw a little something, say, hey, there's a poll, capture their attention. We're at 64%. I like it. I like it. We need your help. Just get there a little more. We see some not currently engaged, exploring, learning. That's great. We definitely don't want to assume that everyone knows this work. So we're glad for those that are here that are just kind of learning and maybe hearing this for the second time. We're almost there. Just a few more with the poll. Miss Casey, I saw you're unmuted. Were you going to say something?
I did. I was just going to encourage, just as you are. Once we get just a few more, there we are. We hit 80%. And so if you want to go ahead, we're going to launch the results for you, so that way you all can see your results as well.
Awesome. Gives us an idea of where we're all at. Some folks not sure. Some folks are implementing scaling changes. I think the majority are exploring and learning. Appreciate that. If you want, go ahead and move on to the next slide.
Just a minute, moving things around.
All good, all good. So on this slide, I mean, I know some folks may see this as a slide. I believe the Mandated Reporting Advisory Committee, we keep these slides available in all of our presentations, because these are our voices, the voices of our lived experts, the why that keeps us centered on this work. And we've centered the why of this work from the beginning as a foundation of the work that we're now and going forward on the experience of lived experts. As I mentioned, former system involved and myself, understanding the barriers and some of the hardships that families face, from experience myself, and really wanting to make sure that we're connecting our families to those supports that even assisted me. And we know not every story is the same, but those support systems really, really played a huge role in my family's success, what I like to call success. May not live on a house with a white picket fence. Well, we do have our home, right? And our family's thriving right now. I have 5 currently in college and 1 working inside the school systems. And so these guys are on fire now because of the support that we received, um, during our time and our transition of making these life changes. And so when we hear these voices, we want to make sure that we remind ourselves of the voices that share their own experiences. If we move on to the next slide, my apologies, my voice is a little raspy, so I may take a drink here and there. We see that over 400,000 allegations are made each year, right? 2 important pieces of the data that we want y'all to really look at is almost 90% of the allegations are not substantiated, meaning that there's nothing that was conclusive enough to where an actual case had to be opened for intervention for the family. Nearly 50% are for general neglect, which is often conflated with poverty. If you move on to the next slide, there's a disproportionate burden, specifically on our Black, African American, and Native American children. We see that 1 in 3 children in the U.S. is subject to an investigation of child abuse by the time they turn 18. 1 in 2 Black and Native American children in California is subject to an investigation of child abuse by the time they turn 18 as well. And move on to the next slide. And even at the top reporting group, education, to be specific, 96% of children with allegations are not substantiated. So we know you may have seen these before, maybe seeing this for the first time, really hoping that it catches the attention, and we really look at, why is it that we're looking at going from reporting to supporting, right? We really need to connect our families to the resources that are available. We see that a lot of times they just don't know, they're not aware of what's there. But if we look at it from a supporting standpoint and, making changes, and we'll look at some of the changes that are going on to where we're actually saying, well, I'm told just to report. No, we're asking, don't just report. Look at how we can support that family. Move on to the next slide. We see the additional harms of mandated reporting, and this is going to be even, I believe, a struggle even moving forward as a reform does happen, because there's been already a lot of trauma, systemic trauma, historical trauma that's gone on. And so it's even though we're doing this work, doesn't mean that families are just going to keep coming and asking for support, right? Which is something that we're also looking at. But I think the biggest piece is understanding that that's there. And so expecting a little bit of pushback from families, coming in with walls, not really trusting the process, but really helping guiding the families to get to that comfort space. Next slide, please. So now moving on to from mandated reporting to community supporting task force, we're talking about a little bit of the of standing up the mandated reporting to community supporting task force. Go on to the next slide. We look at some of the history and building the momentum, right? The work to move from reporting to support families, it didn't happen overnight. As Miss Kathy and Dana had mentioned, some of this ongoing work that has been going on for quite some time now. The momentum really started with the Families First Prevention Services Act in 2018, which California began to advance recommendations for how to advance prevention, a plan that was far bolder than what was offered by the Family First Prevention Services Act. Several actions bolstered the movement along the way. We have the Bill AB 2085 that changed the legal definition of what could be reported as general neglect, and a series of issue briefs put a spotlight on the data that showed the disproportionate overreporting of Black, African American, and Native American children, and the significant gap between allegations and substantiations. And as I mentioned before, this data, you just cannot ignore this kind of work or the data. We encourage you to scan these QR codes and just read more of these reports, kind of get to familiarize yourself with the content and the history of this work, because we're going to be depending on you all to be our champions in moving this work and spreading the word and letting your peers know and your partners know of the changes that are coming and that have already started. Go on to the next slide. So what does it look like to stand up the mandated reporting to community supporting task force? Um, There was a seminal set of recommendations from the Prevention and Early Intervention Committee that was advanced and approved by the Child Welfare Council in March of 2023, as Ms. Kathy had mentioned. The first of those recommendations was to stand up the mandated reporting to community supporting task force, something that I was also a part of as one of the subcommittees of legal and liability. There are a lot of numbers here. The main point is that we approach this work differently. It wasn't the same people making the decisions, creating something at the table. They were very intentional to create this task force with many different perspectives and different eyes on it. Over 80% of the task force had either worked in or had lived experience with the mandated reporting system, and the task force was diverse at every level, including their work, their roles, and geographic locations and perspectives, again, intentionally. We'll move on to the next slide, please. So we stood up, the same was true of the composition of the 5 subcommittees of the task force. And in total, across the task force and its subcommittees, there were nearly 100 committed, informed, and diverse individuals moving this work forward and building the momentum for transformation. And sitting in those subcommittees, I could only express the passion that I heard at all of our meetings, including the general task force meetings. Move on to the next slide. So looking at setting up the key levers is really what committee you see here with data and accountability, continuing to undergird this work with data ensures that recommendations are being moved forward in a way intended to make sustainable change. The very first recommendation was to stand up the Mandated Reporting Advisory Committee, which you will hear more about in just a bit. And with the passage of SB 119, the Mandated Reporting Advisory Committee is now a statutory body for the ongoing transformation to support and not report families. And just to be clear, it is the MRAC. Do not say MRAC around anyone here because you're going to get their eyebrows raised. Trust me. The other 2 recommendations have to do with the essential work of continuously monitoring disparities in child welfare systems to ensure change is happening and to adjust course if needed. And you want to move on to the next key lever of policy. This second lever acknowledges that we will always need to monitor current laws relating to mandated reporting to ensure they're supporting the safety and well-being of children and families and address areas where they are not. Recommendations here include further analysis and action relating to Child Abuse and Neglect Reporting Act. And as we move forward with the statewide gold standard mandated reporting training and tools to support precision in mandated reporting, there is a recommendation to pilot to remove liability from mandated reporters when they use the training and tools to fidelity. Yes, you did hear that correctly. There's a recommendation to pilot to remove liability from mandated reporters when they use the training tools to fidelity. We all know how much this liability drives fear in the behavior, discomfort maybe of over-reporting with mandated reporting. Move on to the next slide, please. I believe this is training. When you look at training, is foundational for shifting from mandated reporting to community supporting. Current and previous training only emphasize report, right? That's all we walk away from. If anything, we walk away from the training is, if anything, when in doubt, just report, right? We can't change the system until we change that message. And if you back it up with the data and tools essential to behavior change, right? Training gives mandated reporters the why and the how of shifting to reporting to supporting. And the recommendations focus on creating a statewide gold standard training, which I spoke about already, with a set of specific and required content that will help change behavior and safety, supporting families and their communities. And this is happening now. We hope to have a new training rolled out this year, and it will be promoted broadly. And second to that recommendation is also implementing AB 2085 with fidelity. So as we mentioned earlier, AB 2085 fundamentally changes the reporting of general neglect. So this law clarifies that a parent's economic status should not trigger a general neglect report. You have a family living in a car, well, let's look at how we can connect them to those resources that are available to support the family rather than just reporting, right? Because that's what initially we've been conditioned to think based on the current training. Now, when you move on to the next slide, as far as community pathway, mandated reporters need a consistent and robust alternative to reporting families. Community supports and services already exist and can be better used by mandated reporters. The building of community pathways as part of Family First Prevention Services will create a reports as an opportunity. So what this recommendation is not, it's not about building community pathways. That work is happening through the Families First Prevention Services Advisory Committee and its other committees, as Kathy spoke about earlier. I did just get a message that my internet's unstable. Can y'all still hear me? Alicia, can you give me a thumbs up because I can see you. Okay, cool. Thank you. The MRAC is focused on ways to make connections to the community pathways to mandated reporters have an alternative to reporting. The recommendations focus on working with California Department of Social Services to assess what is currently available as supports and services to families so we can strategically grow and sustain community pathways. And to use current levers like the county comprehensive prevention plans to add information about mandated reporting as part of the ongoing embedded work of prevention. They must go hand in hand. So I don't know if in the chat, just for us, if you're familiar with your current comprehensive prevention plans in your local area, go ahead and put that in the chat and we can capture that. Narrative shift. Next slide, please. Changing the way we think about the talk and about keeping children and families safe together is all of our responsibilities. Yours, mine, and everyone in between, right? As I mentioned earlier, the momentum for changing is building. It's happening. It's not something that we need to wait for. It's currently going on right now, even behind the scenes. We invite you to continue to get familiar with the data, couple the data with what you see and know from your current work and local work with your families, and help shift the narrative of what children and families need to be safe together and well. You're the voices at times. You're the voices for your families in your local area. And so knowing this information is very, very valuable to families to come. Go ahead and turn it over to Miss Alicia, my fellow tri-chair.
Thank you so much, Juan. Excited to continue the conversation, but I think one of the things that what Juan just went over reminds me of the opportunity to go upstream, right? Many times as mandated reporters, we get our training. And a fundamental question that I often ask when I present to folks is, are we reporting things because of fears related to children's safety, or are we reporting things because of fears of liability individually or organizationally? What is the primary driver? And again, what are our alternatives further upstream? So I'm really proud and excited to be part of this work. And also the centering of those who have been impacted by and have experience with these systems, so that we can, Maya Angelou said, do the best that you can until you know better. And then when you know better, do better. And here we are, getting to do better. So excited to share a little bit about standing up the Mandated Reporting Advisory Committee. If we can go to the next slide, please. So based on kind of your registrations as well, and just being mindful and the poll results, some of you are very new to this work. Really encourage you to kind of dig into the materials. But please know that there is a body that has been put together that is working at the state level to put the pieces together and to serve as a hub and a driver and a battery in partnership with multiple state agencies, as called out in those task force recommendations that Juan reviewed with us. So we have 36 seats. We did have specific categories where we were looking for folks with expertise in specific areas. Again, this was sort of prescribed. Tri-chairs, again, really grateful to be partnered with Juan and Janae. And hopefully we're representing her well today. And really, I know she regrets not being able to be here with us. So just I'll go through a few slides that sort of just illustrate the depth and breadth of our bench here, right? Again, recognizing that we all have a part in reshaping these systems and the importance of having really diverse perspectives to help drive the work and also be able to speak and translate some of what we're trying to do across sectors. Next slide, please. Okay, so I mentioned the state agencies, and I'm very new to state work, so there are lots of acronyms here, but we've got some great partnerships with multiple state agencies that are called out in the task force report with specific recommendations that they are helping to drive in partnership with us. So again, grateful to be that hub to bring those experts to the conversation in partnership with state agencies. Next slide, please. In terms of standing up a committee, right, the Mandated Reporting Advisory Committee, again, really proud of all of the efforts that went into identifying folks to be part of this. That included 6 state association seats, and we went through a really robust selection process as well and had applications across multiple sectors. So these are just examples of the state associations that are at the table with us, again, recognizing that the translation, you saw one slide around the different sectors, right, of mandated reporters and the roles that they have played. Again, I'm sort of representing education, and as a tri-chair, I'm also representing child and family serving entities in this seat. And this does come back to sort of, this is a whole systems reform effort, and it does require robust partnerships that include state associations as well. Next slide, please. And this is just a snapshot of who all we have in our midst helping to lead via the MRAC. And again, we're going to be inviting you all to be part of expanding this work in all of the spaces you occupy, but this is a representation across our Mandated Reporting Advisory Committee. Next slide, please. So what are all of these folks up to? What are we doing? Again, we're going to spend a little bit of time soon hearing from you about what you know about what's happening in your area. But wanted to start with an overview of what we're doing to hopefully find points of connection around the different levers of change that Juan presented to us. Next slide, please. Okay, so that report, which if you haven't read, I'm sure you will, the Mandated Reporting Task Force, identified some key levers that are necessary to implement systemic change in child welfare. That includes data and accountability, of course, right? Again, these systems are designed to get the results they do. So how do we hold the system accountable to equitable and improved outcomes, right? Child safety, and also, again, sort of reducing unnecessary and inappropriate surveillance, right? Over surveillance in specific communities based on misunderstandings or poor training. Policy, right? Juan mentioned, and sort of curious, I don't know if by a show of like in the chat, if you're familiar with Assembly Bill 2085, and we asked you that question at registration, there were some folks that were, but it seemed like a good number of folks were not familiar with AB 2085. That is a law that actually narrowed the definition of general neglect, that required that in order for a situation to be reportable, that there needed to be some substantial risk of serious injury or illness to a child that's associated with that lack of basic need. So that's an example of a policy. It became the law of the land in January of 2023. And yet in education, I know much of the training that we receive is still not being specific about what is no longer appropriate to call in, and that should be handled a different way. What other policies are needed again, and we'll talk a little bit more about how these work groups are working through each of these levers of change to, again, work on a whole system reform to improve the system for the better for all kids and families. Next up, training. Again, we'll talk a little bit about that. Sorry, back one. And I'll take you through very high level. I promise I'm not going to read the tables to you, but I think it's important to kind of have a high level view of the way that this task force thought about how we comprehensively transform the system and their implications for all of our work wherever we are serving children and families. This connection to community pathways that Kathy spoke to briefly also in the intro and part of that ecosystem. How do we get further upstream? How do we offer alternatives to mandated reporters? And then narrative shift, which is our mindsets, right? Our frame of mind and the way that we think about mandated reporting and our role in supporting the safety of children and families. Next slide, please. Okay, so this is just sort of an example of how each of the work groups has a lever of change, as I mentioned, and we've taken responsibility for all of the recommendations that are in the task force report, bringing those forward sort of from planning into action now. So we have identified deliverables in terms of each of the recommendations. We've identified activities that will help us to make progress on achieving those deliverables, and we've committed ourselves to a timeline around the achievement of those. And this is to keep ourselves and each other honest. So again, inviting you to be part of this work. We recognize the important role that training has. And we also know for most folks, there is no required standard training. So it's sort of a choose your own adventure. In education, again, I've been to live trainings and I've taken online 20-minute trainings. That's the same one every year that you click through, and most folks aren't even really paying attention. I know we know that this topic requires a lot more intentionality than we are currently providing to our mandated reporters in most cases. Next slide, please. Okay, we'll talk a little bit about the work that Data and Accountability is doing. I am a co-chair on that work group, and really excited again about this piece because these systems are designed to get the results they do. How do we look at data? You may be familiar with the California Child Welfare Project at Berkeley. My co-chair runs that department. There's a lot of publicly available data and then some other data sets that are available that can help us to understand what's happening in these systems. Juan shared some of the data around, for example, the number of mandated reports related to general neglect, the mandated reporter types and the substantiation rates for the calls that they make. I think it's very distressing to me as a person in education to know that 94% of the time, the calls that we're making are not substantiated. That says something. And again, it speaks to unnecessary harm, as was lifted up. What could we have done differently to better support a family and invite vulnerable families in, as opposed to potentially marginalizing them further and further alienating them? And again, imagining, I was that person knocking on the door. As a parent or caregiver, what does it feel like to have that knock at the door and to have someone share with you that someone has a concern that you're not taking care of that most precious person, right? Your child. And there are times that that's necessary. And then there are times that it's not. And are we being discerning about when that is? So to me, data is really at the heart of this, because in order for the system to change, we have to hold ourselves to better outcomes. And again, this team is working really hard to make sure we're making sense of that and that we have the right data points to look at. Okay, community pathways. So again, this has sort of been touched on, but what are the alternatives to reporting? Those who are familiar with their state plans, you all lifted up in the chat. A piece of that is the comprehensive prevention plans. What are those systems that are being put in place by counties to redirect some of those funds that would have gone to families being involved in child welfare, and instead to provide support that is preventative for those that might be at risk of coming into contact with the system? And also offering an alternative to mandated reporters, right? Because there are many folks who, when we've done listening sessions and conducted surveys, they've expressed that they're calling sometimes when they don't have a child safety concern because they're really not sure where else to go to find resources or supports for a family. But understanding in LA County, our system's called, it's called the Department of Children and Family Services. But is this a place where you go to get resources for families, or are there alternatives that we really should be leveraging to support families in community? So the Community Pathways team is doing an awful lot of really good work there to understand, what that landscape looks like and to ensure that mandated reporters have the information and resources they need and that our system is going further upstream in every possible way. Thank you. Next slide, please. Okay, and I touched on policy, but again, sort of lifting up the importance of changes in the law, right? The law around general neglect in California was problematic, overly broad. We know general neglect is this big black box of calls for all sorts of different reasons. So policy change is hard work, but to the extent that we can move our systems and change laws, we can also support compliance with those laws through additional training and communications, but making sure that we are keeping that at the forefront, because we know that, and it's been wonderful and Casey Family Programs is doing work to bring together jurisdictions from all over the country, because this work isn't just happening in California, it's actually happening all over our country. And learning from each other has been really powerful to understand how different states and jurisdictions are defining and improving their mandated reporting policies, and also what is reportable and by whom. So that is ongoing work. Next slide, please. And last but certainly not least is narrative shift. When we present this information to superintendents and education, one of the things that really sticks out to me is a superintendent who said, how do we unring that bell? That bell has been ringing for a long time with a very clear and specific message. Don't ask questions, don't clarify. Those mandated reports are, that again, we know what's happening. Those of us who have been in this system for a while. So working on mindset is a really important piece to this. What is our understanding of how to keep kids safe, how to support strong families? How do we understand our mandate to report? Is our child welfare system set up to protect children from harm? And in what situations might it have the potential to do greater harm than it is preventing? And again, as a child abuse investigator myself, I experienced all of those things. So narrative shift, really coming up with a strategy that addresses the underlying narratives and beliefs that folks have, what we've been conditioned to think about, so that we can create some new paradigms and refine our thinking based on the knowledge that we have now. Again, thanks to Maya Angelou, do the best that you can until you know better. And then when you know better, we really do need to do better. So that's that. Thank you so much. Next slide. Something else that we are doing as a mandated reporting advisory committee is we are working on a place where this work intersects. Again, there are a number of recommendations that came out of the task force. One thing that should feel in some ways like low-hanging fruit, because it's hard to change the law, but this is the law. And again, I don't know if I saw anything in the chat, so I'm going to pause for a second this time when I ask the question. Before today's conversation, or before you were asked via the survey to register for this training, if you were familiar with Assembly Bill 2085 that narrowed the definition of general neglect, and also clarified that poverty in and of itself is not neglect. If you were familiar with that law, can you please, actually the opposite. If you are not familiar, can you say, no, I was not familiar in the chat? Just to help us calibrate again, the folks that are in the space. So please take a second. And it's okay. Again, it comes back to sort of, this is the opportunity, and we're really grateful to bring this information to our communities and to our child and family serving entities. And again, I just presented to a group of social workers, over 100 school social workers in Bakersfield last week. And the number of them that were not familiar was very surprising to me. And this comes back to sort of what we're doing, what our agencies are doing to comply with the law and to support this shift in practice. So our MRAC, across those work groups that we talked a little bit about, are working to make sure that AB 2085, one of the recommendations is AB 2085 will be implemented with fidelity. We will stop reporting situations. We will seek to ensure that mandated reporters know that situations need to include, if there's a failure to provide specific things, right? Food, clothing, shelter, supervision, there needs to be a substantial risk of serious injury or illness for it to be reportable. And again, clarifying, poverty in and of itself is not reportable as neglect. And I don't know if many of you who've been in this system for a while, you might remember when we had to change the law in the state to clarify that homelessness in and of itself was not a reason to report a family to Child Protective Services. So this law is our low-hanging fruit. So across work streams, we've identified this as an intersection for our narrative group, our narrative change group, our policy work group, our data and accountability group, community support pathways. It's been the law of the land now for over 3 years. So what can we do to lean into this law to ensure that we implement this law in the state of California to help reduce over-surveillance and disparate surveillance in some of our communities? So really excited to be part of that and to strategize with the work groups to make sure that we're bringing our expertise and our energy together to implement this law with fidelity. Thank you all so much for weighing in the chat. I see lots of not familiars. Grateful to be the one to share this information and hoping you'll be able to pay it forward. Okay, next slide, please. I think Juan lifted this up, but it doesn't hurt to reiterate that this statewide group, this MRAC, that I'm really proud to be an inaugural member of, we're not just a committee of folks at the state level, and there are a lot of great people doing great things at the state level in a lot of different spaces, but we are actually in statute and we're tasked with carrying out the recommendations of this task force. And that is different. It's fundamentally different. Again, when we talk to folks across the country, I've heard several people say it's incredible, right? Our state needs something like this to ensure that there is a shift, that we're holding ourselves and our state partners and our systems accountable to move forward, to improve this system, to protect kids better, to ensure that the right situations are brought to child welfare and that other situations are supported in the ways that they should be in our communities. We want to eliminate disparities in the child welfare system. And again, only a few of those Juan lifted up. There is a lot of data. And again, the task force report provides a wonderful and robust overview of why this work is so critical and part of our ethical responsibility here in the state of California. So this is just a little bit more about the, us being in legislation. I had the honor of presenting with Juan and Janae and Dana and Kathy at the California Child Welfare Council just maybe a month and a half ago, our first report as an MRAC. And again, really honored to be part of this inaugural work and being in legislation and to see so many of the task force recommendations start to take shape, as Dana said, in such a short time when it comes to things like systems change. Yes. Dr. Martin Luther King just had a birthday. We just celebrated his birthday. One of my other favorite quotes is, "The arc of the moral universe is long, but it bends toward justice." This work is bending that arc toward justice for our kids and their families. So again, really proud and grateful to see it move in this way and to be supported by the state of California. Okay. So we're just going to check off some of the things we've done, and then we're going to have a dialogue with all of you. So in terms of like the first recommendation of the task force, tri-chairs were selected. Again, Juan, Janae, and I are serving in that capacity to help lead this work with tremendous backbone support. We have the 36-member MRAC established. The task force members are in place. We have a deep and ongoing commitment from California Health and Human Services and the statewide associations that I lifted up early on. And again, this sort of ongoing commitment to folks who have been impacted by our system, both positively and negatively, but to understand what needs to change, ensuring that we are centering lived expertise and experience, that we have diverse membership and perspectives, that we have dialogue about the things about this work that are hard, but that also we are not just sort of, pontificating from an ivory tower, but working with folks who are within this system to understand how best to reshape what is happening. Next slide, please. Part of the progress that we've made is presentations like this, where we are finding any place we can go, conferences, events, this back alley in LA, I will go anywhere to present this content. So we presented at statewide, conferences, presented at national meetings. And again, this is sort of a partnership across the MRAC. Thank you, Juan, for laughing at my silly joke. Literally, this is every week where I find, I'm finding places where I can speak to this. Also, Casey graciously contracted with a communications firm, and the Narrative Shift group is socializing messaging, right? Again, to try to make sure that we're tackling some of the misinformation, right? And replacing myths with facts about what we're trying to accomplish here. These work groups have been established. We have co-chairs for the work groups. They've been meeting since June, again, across these 5 levers of change. And we submitted that report and had the opportunity to present to our state's California Child Welfare Council on this progress that I'm highlighting here for you this afternoon. Okay, next slide, please. Okay, so now we get to the good stuff. I hope this was helpful. I know, we covered a lot of content. For those of you who are new or newer to this work, it might feel like, oh my goodness, what is all of this? But hopefully you feel inspired. Some of you in this space have some experience or awareness, and you indicated in your survey that you're somewhere on the path. You as an individual or potentially your agency, you may have awareness. At least a third of you weren't sure about your agency's level of involvement. So we're going to establish some breakout rooms, and absolutely, yes. So we know we had 8 rooms. So if you were the designee, if you can go ahead and thank you very much, Melissa, for raising your hand and maybe knowing which room you were in. And Carol, are you a report out designee for your team? Please go ahead, come off mute. Thank you so much.
Okay, great. Sorry. Yeah,
No worries.
I didn't realize the room was so big, and I kept thinking, when are we going to our room? So never
It's
been
just
in
such
a
an
room
incredible group.
quite that big. Yes, it really was.
Thank you.
Well, is it okay if I just give you kind of an overview of all the questions?
Absolutely. Yeah. What
Okay.
did you learn?
Well, we had people from a couple of different areas, some from CalWorks. There were people who worked 0 to 3 populations, somebody else who worked with adolescents, people from the family resource centers. So I think we had a good grouping of people. And I think for the most part, we're just trying to stay up on what's new. We're all looking for support from social services to really give us some direction and some specifics. And so I know that's coming in. I know they're going to be working on a new mandated reporter training in my area, which is childcare. So we're all looking forward to that. So, but I think everyone was happy to embrace helping people and looking at strength-based solutions. We just aren't really sure where all of those resources are. The person from the Family Resource Center, I wasn't able to hear back from her about if she felt like, gosh, we've got all those resources now. I know you guys mentioned something about potentially some dollars coming our way, maybe to support this work. So that would be nice. And, we've talked a little bit about getting out of the when in doubt, fill it out. Although we had Juan jump in to remind us, you still have to report those ugly things. And so, I think that just makes you, I don't know, a little hesitant about how many questions do we ask? Because that child wearing a turtleneck in the summer Is it they don't
Mhm.
have enough clothing?
Mhm.
Or is it that they're hiding bruises? And we don't want to like start asking questions when we're not really supposed to be doing that if it is physical abuse versus trying to determine where they might need some of those resources. So, and again, most of us, I think, are just looking for that direction and just at least trying to inform people within our own agencies
Mhm.
and perhaps even reaching out to people or, to our communities to say, what are the needs? Are you needing some of these things? Please come and see us if you are, and we'll connect you. So trying to be proactive, but also waiting to make sure we're doing it, following the letter of the law, if you will.
Absolutely. Really appreciate that. So you lifted up, this was a really good conversation. So many important aspects of this. How do we operationalize these changes, right? Like what are the concrete tools that are available to support that? How do we clarify versus investigating, right? Or so I think there's a lot of opportunity there, and we will share a few resources. I can share like in LA, in our jurisdiction, we've developed some tools and resources that are free and available to everyone now. And I know the state is working on finalizing a training around AB 2085 specifically that I believe will be available later this year. So the question is like, what do you do in the meantime? And looking for support. So really excited to be able to share resources with you all as a part of this as we when we close out. Troy, your hand is up. Did you want to share?
Hi, sure. Our group didn't have a designee.
Thank
Uh,
you for volunteering.
so I just kind of assumed because I talked the most that I should probably just. So the biggest takeaway that I had from our group was it seems like a lot of us are really new to all of this, including myself. So just to be completely candid, like when I first got into the breakout room, my head was still swirling because this is like my first major sit in on anything like this. So with everything that you guys were talking about, it very much felt like it's stuff that everybody already knew that I didn't know. So I felt like I didn't really know a whole lot of what anybody was saying. And it seemed like that for most of our breakout room. At least that's like um what it felt like. So when it comes to the diversity of our breakout group, everybody will have to forgive me. My brain cells were all fighting with each other still at that point in time. So I do know that we had somebody in high risk for children with or for those with developmental delays. And I do know that we had people from quite a few different counties. I'm from Shasta County. When we first jumped in, I didn't see very many people from Shasta County. So, for us, we have like really high rates of CPS cases for our area and high rates of ACEs scores and things like that. So, one of the things that like I talked about for what we could be doing is working towards a lot of prevention rather than reaction. I think that right now, like our county specifically is very reactionary. We don't have a whole lot of resources. So getting access to additional resources is something that would be really beneficial. The task force report seems like something that is going to be a really helpful tool for us to review. So when it comes to like how can MRAC help advance like your reform goals, it seems like being able to like having easier access points when it comes to the data and those key points that that are trying to be nailed home. That would be really helpful for us. And so I think one of the biggest commitments that like at least for our organization is being able to review that report and making sure that for our educational stuff, we are the most up to date with like the current data and the current things that need to be communicated so people will feel comfortable with reporting.
Thank you so much for that, Troy. Incredibly helpful. So I heard a few important things, and one of them I think is this idea that the information's overwhelming, and I'm empathetic with that. I've worked in LA County for a number of years, and only through this tri-chair work have I been exposed to the state level efforts. And it is overwhelming, like just how even the ecosystem, right? Kathy lifted that up. There are all these moving parts. How do they work together? And when you're new to the information, it is a lot. And I know when I present this content in education, there are a lot of folks who are like a little bit stunned in the beginning, right? Like, why is this the first time that I'm hearing something about this? This seems like this is something really important. So, and then the access points piece, right? Like, how do people have ready access to the information to help them be a champion, right? To like move the needle and to have talking points and accurate and timely data that speak to what's going on, not just across the state, but in your own particular county. And hopefully we'll share a few resources that will help with that as we close out. But thank you. Really appreciate you jumping in. Monica, I think your hand was up a little bit ago. Were you going to share on behalf of your group?
There's no take backs.
No take back. You came off mute. Okay. Did you want to add anything? Go ahead.
Did you mean me, Elisa?
Yes. Sorry,
Okay.
Monica.
You know, it's funny that like I didn't raise my hand, but I was thinking. Anyway.
Oh, okay. Maybe I could just see that look in that twinkle.
You wanted communication. Yeah. My room was a little bit quiet, and I think it's probably around this being new to a lot of people. To me, I feel like I'm holding very important information that more people should know, and so I feel like just anxious to really. I'm glad that you said that you have some other resources to share. I think people have to be exposed to these conversations because it's going to be a whole mindset shift, especially for people that have been doing this work for so long. The concept of a mandated reporter, it just means certain things to people. So we really, a lot of what was shared for the people that did share in my group. In fact, one person was saying, "Oh, I'm hoping more people talk because I want to hear." So I'm sure that this is helping them to hear from the other groups. Is that training access, any resources, any guides, anything. I think also just being invited, just I don't know, having more like forums where people are having this discussion to get used to some of the languaging and just those shifts that we have to do. I feel like the training can't be available soon enough because how many opportunities are going to happen in between now and then to hopefully not cause harm and shift the way we're doing things. So I think it's so important. So any of that, in terms of like commitments, I think thank you for the guidance that you're sharing. I'm definitely going to share that further and dive deep into that. But anything that comes up, and if there's any other forums where we can just invite staff to kind of just get acquainted, because I think like even this group, we're seeing that a lot of people are like, oh, okay. I think it's a big deal. I had an experience where my own family member was, somebody reported on us, and it was based on just the thought of a very new therapist thinking like, oh, well, this is of a concern. And I think if there had been more of a discussion and that maybe that report didn't have to be made because nobody was at risk. But I think, for us, we're in a good, stable place where we got through that. But I know that for some families, it harms them for a long time, especially if there's a removal of a child or anything like that. I'm particularly concerned, and I love that you're heading and a big part of this group, Alicia, because at Regional Center, we have a lot of, situations where we have, like kids with different diagnoses, particularly some type of autism, and they're making, they're saying certain things that we know they say, and then the police is called and now they're hospitalized. And why is all of that happening when these kids just need additional support? So I'm looking forward to more, and hopefully we can invite more people to the table. And I'm definitely going to be, like bugging people here to figure out like when we can move things along and just have more open conversations about this.
Thank you, Monica. That's incredible. So I heard a few things. Casey, is there something urgent? Did you need to weigh in?
Yeah, I just was going to say that I know the recurrence of resources available today has been mentioned, and so I just wanted to let you all know and remind you that today's training is being recorded and you'll be able to go back and watch it and go back and look at all these resources. So.
Thank you for that, Casey. So it kind of reflecting back what Monica shared, this idea that like once we hear it, we can't unhear it, right? There's a sense of urgency that like there are things we need to do and people need to know about this. So thinking about like the idea of, should we offer this again? And you can send a friend or invite or include somebody else. But I want to share, some of you in your groups, you may have talked about resources or things that your agencies are doing, but I think something, the state is doing some tremendous work and they're making a lot of progress in putting together additional content. But LA County, I'm grateful to also be a partner in our county with our county agency that is supporting a mandated supporting initiative. Our county board of supervisors put out a motion and we were tasked with developing training and decision support tools. So the supportingfamilies.lacounty.gov website, while some of the resources and information are specific to LA County, you'll find there a link to a few things that might be really helpful to kind of like learn a little bit more and digest some of this, especially as it relates to general neglect and that change in the law. There is a link to register for a training. This training is free. The UCLA Center, Wellbeing for LA Center, is a platform that like you just register for an account with UCLA. Again, there's no cost for doing it. And there's a training supplement that actually provides recommended procedures to assess situations against this change in law, AB 2085. And it uses a decision-making tool to support people. So there's some tools and resources like a desk reference where you can say, okay, here's my situation. It provides clarification about the difference between, asking clarifying questions and investigating, right? Which is what I think I heard you say as well, like some of the fear around, is it okay to even ask questions, right? Someone mentioned the student with the turtleneck in the summertime. Again, some real important and helpful points of clarification from county child welfare. Again, our Child Protective Services hotline was part of developing the training. So hopefully that's helpful to you. If you're in the education space, the other resource that I want to lift up for LA County, and I'm going to say like our website is not as beautiful as I would like it to be, but we have done listening sessions and we have a lot of materials on our County Office of Education website as well. To try to raise awareness of mandated reporting reform. Our superintendent invited our county local education agencies, our districts, we have 80 districts in LA County, to a summit, and we had over 45 district leaders participate to learn more about this. Many of them are implementing this supplemental training. So there is no gold standard training for everybody that addresses, this change in the law and meets that mandate for training. But this supplement, right, provides the additional information that folks need in addition to the core training, and hopefully it could be a resource to you. So yeah, it's a great question in terms of the guidelines. So it really is in alignment with the law. So you could learn from it. Is it helpful to talk with and consult with your county about how they're implementing this law? Yes, but the law is the law of the state of California. So I think you can get a lot of good information from there. And I want to also lift up, our county council approved this training. So, the most risk of this is the other piece, right? Like oftentimes our trainings are developed by risk management and insurance companies, and those all have their place. But risk mitigation is their primary concern. And LA County's county council did approve this training content. So we feel very confident that it stands up to the requirements of the state law and provides some really helpful tools and resources. And we're partnered with the state in terms of like trying to figure out how this training, what parts of this might be helpful to the state training as well. So just want to mention that. And if I can be a resource to you, I'm also happy to do so individually, to connect you with folks. Okay, thank you. So would love to hear if there are other groups who would like to share out a little bit about what you talked about, what you got out of the conversation, and what you might need. Really appreciate those of you who've weighed in and shared where you're at with all of this. So if you were a reporter or like Troy, just would like to volunteer to represent the conversation you had, anybody who would like to do that, please go ahead and raise your hand and or come off mute. We'd really love to hear from you.
Alicia, someone wrote their report in the chat, if you can look at that.
I see. Okay, so I can read that. Thank you, Natalie. So our group discussed these as some of the supports we would need. Help addressing fears of mandated or of MRPs. MRPs? Sorry, that's another acronym I don't know. Maybe it's just because
mandated reporters. Yes, sorry.
Okay, just make it no, that's okay. Thank you. Okay, so help partners understand how they can pull down funding. So help address fears of mandated reporters. Yes, like the fear of liability. Interesting to think like if people are better trained and better prepared, right? This is an individual mandate based on people's training and experience. So if folks receive better training, then they're in a better position to support. Part of our county's work too has included thinking through when you provide training, is there an opportunity for consultation, right? You can't require consultation, but if you have other folks you can kind of talk to about, okay, here's what I see. Is this like, what do you think? Like, what are your, in the end, that individual has to decide whether they're going to make a report or not. But are there protocols that can be built in that reduce that isolation in making the decision and again, create more standard decision-making practices? So next thing, help partners understand how they can pull down funding for the EBPs and technical support. So back to like the Families First Prevention Services and the evidence-based approaches that have been identified by every county. So this is all published publicly. There's a website with a map that speaks to the comprehensive prevention plans and the investments that have been identified by each county. So learning more about that and what that network looks like now, but that's a great example. Technical support for claiming to Medi-Cal, helping mandated reporters understand where the supports are coming from beyond those, yes. And I think a lot about, like, as a school social worker, the mapping, right? Like having a network, having the people you can do warm handoffs to. And I think one of the other powerful things that I am often reminded of is the ability for families to navigate themselves to the supports that they need, right? That it's not even always referral based, that families have agency as well. So is there visibility? And is it okay to need help with something, right? I often say parenting is the hardest job that any of us really will ever do. Our kids will humble us in any number of ways. They know our buttons. So it can be a very isolating experience. I know one of the things I tried to do as an investigator was to demystify this idea that some parents are perfect and, you know, somehow that we're different, right? We're all connected in this and we're going to struggle. What are the sources of support? No family is going to call child welfare seeking support. So where is that support? And what role do different child, family, and family serving agencies have in providing it? Okay, so helping mandated reporters understand where the supports are coming from. That's a big one, right? Like the visibility of those supports. In most counties, the state block grant FFPS funds are mostly allocated for. Yes, I know LA County, that's the case as well, only tied to EBPs. Yes, also currently the case. And some counties identified motivational interviewing, right? Like with Fidelity, I think that's one big area where many agencies probably have the potential to be partners. So yes, leaning into that, more funding is needed for concrete needs for families. And I think, I know in our county, one of our challenges, of course, we're huge, and thank you, Melissa and Amanda, I see your hands, I'll get to you in a second, is the mapping of those supports, right? And the recognition of, you know, roles of places like schools and early education and childcare and all the child and family serving entities in making sure that families have what they need, of our faith communities, right? There's some great examples of jurisdictions that have done work with faith communities as well. But that mapping, right? The asset mapping, the resource mapping is definitely a piece. And you'll see on the LA County website, there's a family resource finder there that's an example of potentially how you can organize resources to support families. Okay, Melissa, thank you for raising your hand. Sorry for my little soapbox. Go ahead. What would you like to share?
No problem. And I'm in group 8 and we didn't choose a rep. So if anyone else wants to speak for our group, I'm happy to defer or you can add on. But a few things that I picked up on were, we were a varied group. You know, some people are hearing about this for the first time and others have been in this work for a while in different capacities. And so just excited about having more awareness and the training, the gold standard training, and having a meaningful training where you can really learn about what does it mean to have like significant risk of harm? Like how do you make that call? How do you make that judgment? Rather than just kind of clicking through some slides that you kind of know every year that you do the training. And just sort of navigating the conflict between how do you be supporting when you're a mandated reporter, how do you kind of navigate that window between mandated reporting and community supporting? And then finally, as has been touched on, like the real lack of concrete supports for some families. For example, childcare, like families that are having to go to work and leave young children at home because they don't have childcare resources, or families that are navigating solo parenting because of domestic violence situations and having to leave, being homeless, or have other family members take care of kids because they don't have housing, concrete supports, and they're actually navigating that now. Like, these are real situations that are happening now, and just a real worry about like what the future is going to be like with actual concrete supports as things are, changing in the landscape with the budget and everything moving forward. So those are some worries, coming forward with that. I don't know if there's anyone else from Group A that wants to add to that.
Thank you, Melissa. You're raising some really important points, and where is that support, and can we rely on it over time, and is it adequate, right? Like, what do we need to be expecting from our county partners, from philanthropy, from again, our faith partners, schools, early education, and just communities in general, right? I know something the County Office of Education is leaning into a lot is the Children and Youth Behavioral Health Initiative. There's a schooling fee schedule that is meant to bring additional resources to sustain programs and services, including wellness coaches, the community health workers, and other folks, right, that are hopefully, ideally, like being hired from our communities into our schools, who are natural connectors and liaisons with our families. And how do we maintain a safety net that, as a civil society, right, that we rally around our kids and families when they're vulnerable and they have a need. That is something we absolutely have to wrestle with as a country and as a state, and then in each of our regions. I see another thing in the chat. In addition to support referrals, are there specific funding being allocated to specific needs of families, like housing at the state level, which may help at-risk families address? I'm not aware of new funding streams related to that. I know our county has a lot of, we have a Measure A funding, but because of curtailments at the federal level and other issues, it's not as robust as we had hoped. So that is one of the struggles, is finding the resources that folks need. But when we also come together, we can close the safety net, I think, and again, create hubs. And I think a lot about schools because that's where I am. How do we partner with other child and family serving entities? A community schools approach where you actually map the assets and the folks, right, who are in your community who can be of service to families to help meet those unmet needs as they come up. Thank you. That's really helpful, and definitely something we have to keep on the radar as part of the community supports. I see through Medi-Cal managed care, some eligible folks can get 6 months rent assistance. Yes, and there are some changes related to that. I'm not as familiar with those, but there is definitely good work happening.
And I think that raises a great point as far as what, being familiar, somewhat doing your homework, what is available in your local areas, speaking to your CAD offices, your transitional assistance department offices, your I know here in our county, San Bernardino, we have a children's fund, and I think there's a lot of Help Me Grow, Inland Empire, Help Me Grow, which is somewhat has some funding for housing assistance as well. So I think just being familiar with the resources that are available, look for those champions that are out in the community that are, going to different meetings and connecting with other partners to collaborate with. Like, those are the folks you want to bring on and learn from them.
Thanks so much, Juan. So I know I can't believe it, but we're almost at time. I wanted to reiterate that the materials and the meeting registration links are at the California Child Welfare Council site, and we'll drop that in the chat. And it looks like it's already in the chat. Amazing. And I know we'll close out, but I want to harness the energy that I heard from all of you. Appreciated the conversations in the breakout rooms and you bringing back your thoughts and reflections on what you need to move this work forward. I hope that you will make a commitment to taking an action based on what you've learned and, uplifting that sense of urgency for the change that we can't wait for. What can we do responsibly now to start to move the needle on this? And we're really grateful to partner with you and to have you join this coalition of people who are going to change this system for the children and families of our state. And thank you again. Thank you for participating with us. And with that, I'll hand it back to our hosts and to close us out.
Yeah, I wanted to thank you all for being here as participants. And not only that, but also our amazing panel. I mean, what a wealth of knowledge that you guys got today. I know some of you mentioned it being overwhelming, which is totally understandable. But the important note is that you're here, you got the information when you did, and I heard so many comments about how do I take action? What do I do next? And that's a wonderful thing to hear in this space as we're working together to make these changes. And so, with that being said, that brings us to the end of today's training. I just wanted to let you know and remind you that we do have a follow-up email that goes out around 2 days after today's training. We will have all of these wonderful links for you. We also have, I know we mentioned a little bit about concrete support and how do we build this community for community of resources for our community. And the thing is with that is that we are the key, right? Us in our role can really help gather all of the community resources. That way we are a huge network that where anywhere our families reach out to, they will find someone and they will find help. And so with that being said, we have a protective factor series that's just beginning that covers concrete support and how we can work together for prevention and really covers a lot of these topics. So if you're interested in that, we have the upcoming training link that Lana dropped earlier in the chat that we can drop again, just that way you can go ahead and follow up and see if you want to register for that. So thank you all for being here so much today. Lana's going to drop the link for the survey in the chat as well. I think she already has because she's so fast. And so with that being said, you can click that link. The survey will open up in a separate browser. And once that opens, you can exit out of today's Zoom meeting. And we thank you all for being here so much today. Have a great day. It's